For the CDC came out with their new air quote research into the efficacy of double masking. The research they published wasn't tested on human beings and reeks to high heaven. Perhaps now would be a good time to remind you of new White House Coronavirus Task Force member Dr. Michael Osterholm's words from last June.
There are two lines of answers here. One is about the science-based answers. The other one's about the emotional-based answers. As humans, we all want to be able to do something to protect ourselves, our families, our communities, whatever. But you have to look at the science carefully here. First of all, the environment plays very, very little, if any role at all, in the transmission of this. All this cleaning we're doing, all this hand washing, which, because I work in a lot of other infectious diseases, don't stop hand washing. It's really important, okay? But it's not having a big impact on what we're doing to prevent disease here. All this wiping down, et cetera. The data are not there to support that this is a even minor way of transmission in terms of what goes on. But we do it because it makes us feel good, and we can tell people to do it, and it shows. You can watch people doing it, and therefore, wow, that's good. The second thing is this masking issue. And this is a very, very real issue for me because it's all about healthcare workers at first. We now know, and I've spent my career working on influenza. I've been working on it for 40 years. We have come to understand completely that aerosols are a very critical way which influenza is transmitted. These are those little particles I talked about when you're talking. My office right now is filled. If you had the sunlight coming through the window, you'd see in this office all that dust. That's aerosols. And a lot of them are just from talking, not coughing, not sneezing, none of that. And the challenge we have is that we have increasing data that shows that this is just like flu, that there is really a lot of virus we just put out that way. Well, an N95 respirator, the kind that the tight face-fitting mask that we use in healthcare, and we have to save it for them because we're otherwise already short. I asked for two different reasons. One is it's the material itself that you breathe through. And you breathe through this matrix material, which is actually a pore type material that actually allows air to pass through, but it traps the virus with electrostatic charge and holds it in there. Much like if you think of your Gore-Tex, the rain stays out, but the perspiration gets out. And that's important. But you can actually achieve some of that same filtering with cloth masks, with just plain cloth mask. The problem is it's all about the fit. Unless you have a tight face fit, it's kind of like fixing 3 of the 5 screen doors in your submarine. The air just goes in the sides. It takes the path of least resistance. So when you blow out or blow in, the air is just all there. Well, if I'm in a room full of this virus and aerosols, it's not the front part of the mask that's doing its job. It's the tight fit. And so I say if you don't have an N95, you're not protected. Can a cloth mask or a surgical mask reduce the likelihood? Well, let's look at it from two perspectives. If it's me I'm trying to protect myself, there are some limited data that says it may reduce the risk, but let me just make a point here. If you're walking across an intersection and a semi comes along at 50 miles an hour and hits you as you're walking across, that's not good. But if you're walking across that same intersection and a Ford pickup comes by and hits you at 50 miles an hour, that's not good either. So merely reducing the size didn't stop the outcome from happening that both did. And so all the data we would have say at this point that just masking of itself with a cloth mask or a surgical mask surely may reduce the number of particles you put out, big particles, or the big particles that get in, but it's the little particles that are coming along the sides that are the real problem. And so I'm telling you, I would throw the kitchen sink at this thing if I thought that it would make a difference. Masks are not a major issue. And by the way, in 1918, there were actually some very exhaustive studies done on masks. After that, and John Barry, the historian who we work with closely, will tell you not one of them found that they made any difference. Number two is just think about this, common sense. This is a group of common sense people here. The area of the world where geographically we have the highest frequency of mask wearing is just a social cultural event was in China, Hubei province, China, in November and December of last year. Did that mask wearing have any impact on that emergence of that horrible, horrible city on fire situation. I mean, that was one where we had virtually everyone wearing masks publicly. Didn't make a difference.
He goes on to talk about the scarlet letter impact of, you're a lesser person